Hi, I'm Dr. David, neurosurgeon specialized in pain management. Today's topic is low back pain, which almost everybody have experienced once in a lifetime, including myself. Let me show you my case first. A 42 years old male who mostly works at desk job, recently feeling a decline in overall strength, but not particularly exercising. He began to feel pain in the lower back and sacral area 1 month ago and has been observing the condition while wearing a supportive device. However, the pain did not decrease and he sought out a neurosurgery clinic. X-ray showed formation of osteophytes and degeneration of the intervertebral disc in the lumbar spine, but he was diagnosed with myofascial pain because of his age. The pain was particularly strong during standing and bending motions and was felt throughout the sacrum and lumbar area. A tenderness of the iliocostalis and longissimus muscles were confirmed by palpation. He received physical therapy using HIIT therapy and interference waves and stretch exercise from the longissimus and iliocostalis muscle. As a result, the pain seen at rest was reduced, but the pain in the lower back during bending forward remained. Upon reevaluation of the lower back, it was found that the strength of the multifidus muscle had decreased. Therefore, exercises to increase the strength of the multifidus muscle, including guidance on posture, were performed. The patient pain that occurred during bending motions has disappeared. There may have been parts that were difficult to understand, but I will explain it detail in process. Lower back pain is a broad term that encompasses any pain felt in the lumbar area of the back, regardless of whether it is present during rest or physical activity. Among low back pain, specific types of pain caused by specific conditions such as herniated disc or compression fractures make up about only 15% of cases, while non-specific lower back pain, in which there are no clear imaging findings and the causes cannot be identified, make up about 85% of causes. Within non-specific low back pain, a subtype called degenerative low back pain occurred when the muscles and tendons around the joint are chronically tense. The cause of this can be from overuse or overstress of the lumbar muscles and tendons, and it is characterized by absence of neurologic symptoms such as nerve irritation or paralysis. The muscles of the lower back include the intrinsic muscles such as the semispinalis, multifidus, rotator muscles, and the extrinsic muscles such as erector spinalis and longissimus muscles. Functionally, the intrinsic muscle group provides stability to the spine, while the extrinsic muscle group provide mobility. Both the intrinsic and extrinsic muscles are covered by a common fibrous tissue called the thoracolumbar fascia. When the thoracolumbar fascia becomes tensed, it stabilizes the lower back. However, excessive stress on the fascia can lead to myofascial pain. This stress can be caused by the compensating contraction of muscles such as transverse abdominis, oblique muscles, and quadratus lumborum and gluteus muscles that are attached to the thoracolumbar fascia. This type of stress is often seen in cases of repetitive motions such as work or sports. Also, due to poor posture, pain provocation can occur. Poor posture can cause tension in the thoracolumbar fascia, which increases stability of the lower back. However, this contraction of the fascia can lead to a decrease in the strength of lower back muscles. causing the thoracolumbar fascia to become more dependent and rely more on it. This excessive stress on the thoracolumbar fascia can lead to fatigue and inflammation, which can also cause excessive muscle tension in muscles such as longissimus and erector spinal muscles. Then, how to perform exercises and massage to release the muscles known as erector spinal muscle. Use one hand to apply pressure and hold, first to force pinous process and transverse process. Then use the other hand to stretch erector spinalis towards the head. It is suggested to change hand intermittently to avoid excessive stimulus. The lumbar muscles are covered by a common fascia forming one compartment. Therefore, if the pressure inside the muscle of the extensor muscle increases, it presses the nerve branch which innervate the other back muscles, as shown in this photo. Additionally, the increase in muscle pressure causes a decrease in blood flow and ischemic pain. It has been reported that during flexion of the back, like this, muscle pressure within the back muscle compartment increases more than in physiologic standing posture. These multiple reasons is the cause of myofascial low back pain. It has been reported that the muscle activity of the longissimus, iliocostalis, and multifidus muscles in the lower back are lowest in the extension posture when compared to the other three postures of neutral and flexion with anterior pelvic tilting and posterior pelvic tilting. It gives us hint about the reason the patient with myofascial pain express worst back pain on flexion posture and relief pain on extension posture. Well, to avoid falling in this vicious posture, it is important to maintain a neutral, physiologically forward-leaning posture, as shown in this picture. Keeping the pelvis in the forward tilt posture. Additionally, it is also important to maintain the activity of the multifidus muscle. It can be achieved through exercises that target the muscle and promoting good posture throughout the day. This is how to release multifidus muscle. Use the patient arm as support and then exercise the patient back muscles by stretching the extensor muscle group. The goal of this technique is to alleviate back muscle by promoting balance between muscle groups. Well, this is all I prepared today, and if you have thought that this video is informative and helpful to you, please subscribe to my channel and watch my next video. Thank you very much.